Welcome, everyone. Thank you for joining. I am Dr. Daniel Turner Lloveras, the president of SaludConTech and founding member of the Latino Coalition Against COVID-19. I am with our guest speaker, who needs no introduction. Dolores Huerta has always been a role model for me growing up. My first experience with health activism was sadly when I found out when Cesar Chavez passed away, and my dad announced it at a dinner table, and I said, "Who's Cesar Chavez?" And he became very angry, and I was about to make a run for it, and then he realized that it wasn't my fault. It was his fault that he didn't teach me this thing. Didn't teach me about who he was, and didn't teach me about Dolores Huerta, and didn't teach me about the movement that they had created. And so he told me and my sister Maria to pack our bags. We were driving to Delano, which was a 7-hour drive after dinner. We got there at 2 a.m., set up our tents in pitch darkness. And when I woke up, I saw something that, I will never forget. But I don't think I will ever see that many people, coming together in a movement to pay respects for someone who had done so much. And I would say that Dolores Huerta was there for every step of the way, and she really has shown us what can be done through collective action, what Latinos can accomplish when we come together. She was a school teacher, and she, through multiple different ways, she has taught us in and outside of the class, really, how to make things better for our communities. And without further ado, I'd like to pass the microphone over to Dolores Huerta as she teaches us about health equity through digital literacy and bringing us together through collective action.
Thank you very much, Daniel. And now that you mentioned the Farmworker movement, although I was with the Farmworker movement for, I guess, over 40 years, but I left in 2002. But I do want to share this with the audience here, is that there's been a lot of conversation about healthcare in the Congress right now. And in the Farmworkers Union, we actually started clinics. We had clinics, and we ended up with a good health plan for farm workers. But one of the interesting things is that when we had our clinics, we started our clinics, and we had contracts with all the growers. So we had healthcare as part of our contracts that we signed with them. And so we made them sign up for our health plan, which covered all the farm workers, and we named it after Robert Kennedy, the Robert Kennedy Farm Worker Health Plan. The interesting thing is, when we set up our health plan, all of our attorneys said, well, you've got to get somebody like Blue Cross or one of these systems to come and manage your health plan. And Cesar Chavez, having never gone to high school, who had a very clear way of thinking, said, we don't need anybody to come in and do this for us. We can do it ourselves. And so we set up a system, a healthcare system, where the money that was deducted from the growers, the money that the growers paid for the healthcare plan went directly into the Robert F. Kennedy healthcare system. The bills that the doctors and the hospitals had actually came into the healthcare system, and we paid them. Okay, we trained people to do this, and there was no middle person in the healthcare system. So even though it wasn't a lot of money, we were able to provide really good healthcare services for the farm workers, including operations, and we were even able to get a premium there for if anybody in the family died or the farm worker died, that we were able to get a good, be able to pay them for when somebody passed away, a death benefit. And this is interesting now because there's been a lot of conversations in the Congress, and we're trying to get health care for everybody, Medicare for all, that taking out those middle managers, those HMOs out of the healthcare system would really provide a lot more funding so that people could get a better health care. And of course, as you all know, that there's a lot of conversation also in the U.S. Congress about doing something about the pharmaceuticals because they are charging such outrageous prices. And I know that your symposium has been on all morning, and maybe many of these things may have already been discussed in terms of your conversations, but I think this is something that we all have to get on board for. I had an aneurysm in the year 2000, and I was disabled for about 7 months. I was in 3 different hospitals, including UCLA for almost a month. But my hospital bill was close to $500,000, okay? 500,000. But was I able to pay for that? No, because I am over 65 years old and Medicare paid for my hospital bill. Yes, I did have to pay an amount, but it was an amount that I could afford. But I never would have been able to afford $500,000, but because I had Medicare. And so, I think all of us have to keep that in mind. All of these organizations, including ours, that are we're fighting to get Medicare for everybody. I think this is two really good examples of what we can do with our healthcare systems to make sure that everybody is covered. And I hope also that we are all aware that we, the richest country in the world, the United States of America, the most powerful country in the world, the United States of America, that we do not have universal health care for all of our citizens. Yes, they have this in Europe. And the United Kingdom has had health care for all since after World War II and 1945. There are the Scandinavian countries that have health care for everyone. We have countries in Latin America and even in the Caribbean with Cuba, which is a small, tiny country, that very poor country that has an economic boycott by the United States. But guess what? They have health care for every single person in Cuba. And not only health care, but they have a free college education for everyone in Cuba. And so we have to say, if we are the richest country in the world, why are we not providing this for our residents and citizens of the United States? Some good news coming out of California, and I'm sure maybe all of you may be aware of this, but I just want to repeat it, is that thanks to our Democratic governors, Governor Jerry Brown and now Governor Gavin Newsom, that right now we have undocumented people covered under our California healthcare systems from the age 1 to 26 are currently covered. And last year, the legislature passed to cover people 50 years and above. So we have undocumented people from 1 to 26 years covered, and then from 50 and above. But the greatest news that we have is that the Governor, Gavin Newsom, included in his budget this year to cover everybody 50 years and above, all of our undocumented. Now, that will not go into effect until 2024. But that is such good news, especially for farm workers who, many of them are undocumented. And so that they will also get the coverage that we need under our California covered in our Medi-Cal systems here in California. So I think that is the greatest news. Now, when we talk about telemedicine, here again, in addition to all of the other handicaps that we have, that I'm sure that you have had many discussions about the pre-existing conditions of diabetes and hypertension, obesity, et cetera, that affect our Latino communities, especially our farmworker communities. Well, we know that this is something that really needs to be addressed. But when we talk about telemedicine, how can we make this happen? Many parts of our state in California, people don't even have broadband. They don't have, our people don't have computers. With our work at Dolores Huerta Foundation, we have been able to provide laptops for many of our members. We call it our vecinos, our vecino leaders, the leaders that we have in the 4 different counties where we work, which is the Los Angeles County, the High Desert area, the Antelope Valley, Kern County, Tulare County, and Fresno County. But again, the majority of the people, they don't have computers, they don't have broadbands, and even sometimes when they, if we could give them all computers, they don't know how to use the computers, we're just way back in terms of people having the computer literacy that they need to be able to take advantage of any kind of telemedicine that we might have. And I just want to add to this that we have a whole lack of being able to really inform and teach the Latino community about health issues. We know that conditions like diabetes and hypertension and obesity, that these can all be controlled, but we have to do so much more work in terms of educating our populations. And then again, we have a big issue when it comes to mental illness. Oftentimes, we have people in our community that they feel that this is some kind of a disgrace, that if they have a member of their family that has any kind of mental illness, somehow that people have been cursed. So again, we have to do a lot of education. And then, of course, there's a lack of psychologists and psychiatrists, a lack of social workers that can really address the needs of our community. So, we lack, not only do we lack the broadband, as I mentioned, the computers, we lack the resources so people can afford to be able to get into internet systems when they are available. And of course, we have the lack of the internet systems in themselves. So you might say, especially here in the Central Valley, where I'm speaking to you from here in Bakersfield, this is like a third world area. There is so much need, and we need so many resources to be able to address the medical needs of our community. So we have a long way to go. We have a lot of work to do. And I'm not saying that it's not possible. We do know that there is, again, funding that is going to be made for broadband access. Even with our schools, and I know many of you have gone through this, that many of our areas, because we have a huge education program with the Dolores Huerta Foundation, that they had to bring in buses with hotspots so that the kids could even log into the classroom. Of course, we know a lot of our kids are now going to classrooms in person, but that's also, very, very tricky, because we have days when the kids are sent home because somebody in the classroom tested positive for COVID-19. We're going through a really hard time, but I am really hopeful, because sometimes when we have these difficult things that have happened, like COVID, that coming out of it, it's really spotlighted the areas and the needs that we have in our community. And so once that they're spotlighted, they're highlighted, they're identified, attention is brought to these disparate issues that we have in our Latino community, in our Farmworker community, then it's all like a cry for help. This is where we need the attention. This is where we need the help. And all of us here that are gathered here today, that's what we're here for. We're here to say we need help and go after the resources that we need. And we mustn't forget that this year is an election year. And so we all have to become politically active, and we have to demand that we get more resources here for our Latino community, especially our farm workers, who are the essential workers that put the food on our table every day. The Dolores Huerta Foundation, we are doing a lot of work on the COVID issues. We have canvassers that are going door to door, telling people that they have to sign up, they have to get vaccinated, they have to get their booster shots. And then we also do vaccine clinics every single weekend we're out there in the community, reminding. And by the way, the vaccine clinics, we do them all in the 4 areas that I mentioned, which is the northern part of Los Angeles County, again, here in Kern County, the Bakersfield area, in Fresno, and in Tulare. So healthcare is such an important issue that, we've got to keep talking about it and tell our legislators, not only in the state level and the Congress, that we do need Medicare, healthcare for all, universal healthcare like they have in many, many other countries, but that we still don't have in the United States of America. Si se puede. We are the messengers. We are the ones that have to make this happen, and I know that we can do it. Remembering all the time, as I like to remind everybody, that we have the power, and the power is in the people that are in our community and the people that we serve and the people that belong to our organizations. But we just have to remind them and not to get tired, okay? Not to get tired. We've got to just keep pressing on, communicating, sending emails, phone calls to our legislators, not only in the Congress, but also in Sacramento. Si se puede. Thank you.
Thank you, Dolores, for sharing that with us. There's been a lot of comments in the chat, and there also is a question from our audience. I will see if Eloisa wants to come on stage and ask it. Let's see if she's able to. I think she is. I think she's coming on stage. But in case she's not, oh no, oh there she is. We'll give Eloisa a chance to ask her question.
Yeah, I'm sorry if you can hear me. I know you can't see me. I don't have my camera working.
Oh, okay, but feel free to ask your question.
Yeah, so I'm wondering, and thank you so much for your wonderful sort of experiences shared, Daniel, and for all the guidance and your experience, Dolores. An honor to be here with you guys. I'm wondering, in California, I work for the LA County Department of Public Health, and I, in my humble opinion, believe we've not done a very good, effective job at reaching our Latino community when it comes to information around COVID-19 vaccinations and addressing misinformation, which has been circulating a lot on social media. I'm wondering what community-based organizations do you know about within California, and specifically if there's any particularly in LA County that are really deeply embedded and have the trust of our Latino community, in particular the monolingual Spanish-speaking ones, to be able to become technologically savvy enough to know what information to trust, where to go to get information that's trustworthy, and even just how to navigate in general. Just getting onto a Zoom call, I have found extremely challenging with this population.
Well, the the California Endowment has funded over the years lots of community organizations, and like here in Kern County and also in Fresno County, we kind of formed a coalition in terms of COVID. It was called United Against COVID. So we got all of the nonprofit organizations together, and we formed a coalition, and through this coalition that we have here, and I know they have a similar one in Fresno County, we have been able to engage and do more outreach to many more people through all of these community groups to be able to, and some of them are like the ACLU, the Greater Bakersfield Legal Assistance. We have Líderes Campesinas, thinking that United Farmworkers, others. So we've kind of all formed these coalitions, and that way we've been able to work together to make sure that we get the word out there. The one thing I didn't mention, and I know all of you know this also, is that we have people in our community, especially when some of the evangelical organizations and people that are telling people not to get vaccinated, that the sun is going to take care of them, that if they drink honey or in some other concoctions, that they're not going to get COVID. And this is and you know that this is all very political because it's really aimed against the Biden administration. It's really aimed against the Democratic or political parties, and where they're encouraging people not to get vaccinated, not to get their boosters. And unfortunately, they do have some influence in our Latino community. A lot of these ministers that are putting out this, these lies and that are endangering our community. So, so in our door-to-door work that our canvassers do, they actually inform people where they can get vaccinated, when they can get vaccinated. So we just have to keep talking and talking. And unfortunately, sometimes in some of these families, it isn't until somebody gets really, really sick or somebody dies in their family that they will get vaccinated. So this is where, unfortunately, as you all know, this has all become very, very political. And they think that somehow they're going to hurt the Democratic Party, President Biden, Governor Gavin Newsom, by people not being vaccinated. And unfortunately, it's taking a toll on our people, and many people are dying.
Thank you for sharing that, Dolores. We have one other question from Beth Zachary from Kaiser. Beth?
Yeah, hi, Daniel, Dolores. It's so nice to meet you, and thank you for the work that you're doing. I'm working on a project about digital equity to develop a strategy to help our members. And one of the pieces, of course, is digital literacy. And I don't know if it's really being addressed very well outside of local community organizations. I think nationally we have a problem. And I'm kind of curious if you've seen any solutions that have worked really well for digital literacy or things that you found don't work, and how we reach the populations that maybe have a hesitancy around digital engagement in general.
Well, as I mentioned before, I think the big problem that we have is that we don't have broadband in many of the rural areas. Many of the places where we go canvassing, there is no broadband in those areas. Again, you have the problem that people don't have computers in their homes, and even when they have them, they don't know how to use them. So this is a big issue that we have, I think, in our community, the whole digital divide. So our folks are not, they're not, they're not they're not literate in the internet world. And so this is something that we just really have to pay a lot of attention to and put a lot of resources in there and, get people up to speed. It's leaving our community way behind on the educational level. But now when you think about how this is going to be so important for health, that this is something that we have to really create some programs, get some funding for, and get out there and make something happen. I know that in Fresno, there is a teacher, I think his last name is Gonzalez, who was doing something about creating a kind of a community broadband so that some of these rural areas that don't have it, can make it happen. I know that there's money that has been allocated at the federal level. It hasn't come down to our level yet, but I think pursuing that. But the other thing I want to say that I don't think that this has been a high priority in terms of organizing, but it needs to be because, of course, this is the vision of the future for medicine. In my own family, I just have to say I have a son who's a doctor, and he works with the Kern Regional Center. He's a family practice doctor and has actually was a trainer of doctors here with Kern Medical many years ago. And now he is the doctor for children with special needs throughout Kern, and I think some of the other counties. I have a daughter who's been an she's been an ICU nurse, she's been an ER nurse, and she is now an oncology nurse. And I have two granddaughters that are also nurses. So, the medical issues are and I have been very, very blessed myself. I think if I would not have had these medical folks in my family, I probably wouldn't be alive today because they have always taken such good care of me. But it would be wonderful if every individual could have the kind of backup and medical care that I have had in my 91 years, going on 92.
Right. Thank you for that question, Beth. I'll just chime in about, we were lucky enough to be awarded a HRSA grant recently, a $1 million HRSA grant, which we applied for the Latino Coalition Against COVID-19 with Visión y Compromiso, one of the lead promotores groups in the country. And we're starting now piloting a program called the Digital Compañero Program, where promotores will become the bridge to help Latinos overcome the digital divide by providing devices and not just devices and internet access, because we know that's only one part. The other part, the Digital Compañero Program, is really teaching how to use the internet, how to navigate the World Wide Web, which when you don't know how to navigate, you are susceptible to misinformation because you're unable to seek it out, and instead you wait for information to come to you. So one of the things that we're going to be doing with this program is teaching how to navigate the World Wide Web, how to find good sources of health information, navigate there, read it, and we'll be doing pre and post surveys to see how this intervention helps with not just accessing resources, which we know are online, which went online overnight, but also seeing if it affects people's perception of the vaccine and would help improve access and any type of hesitancy that there might be as well.
Well, we would love to partner with you on that, Daniel. Let's keep in touch on that. When I talk about canvassers, we've had up to 100 canvassers, okay, in all of these areas, and we have canvassing with our organization is like full time. It's not like a part-time position. And we are doing this a lot right now, working particularly focusing on COVID. But yes, we really would like to partner with you on this. Okay, we have in the Dolores Huerta Foundation, we have a whole tech department that is really, I think we have like 4 or 5 people working in just that department. And so, one of our visions that we have for this coming year is not only to do the grassroots community organizing, our education work, our youth group, but since we have been so involved in doing the work on COVID, that we have set up a whole health department within our organization. And we would love, again, to work with you on this.
Definitely would love to work with the Dolores Huerta Foundation. That will always be a pleasure. I was curious, how did you convert from everything you were doing before was in person, and now you have a tech group of 5 people doing tech? How did that start, and what inspired that sort of conversion of people to learning the tech and then having a team that's doing that type of work?
Well, I do a lot of presentations, and of course, with technology, it makes it so much easier. Where before I would have to fly somewhere or travel somewhere to do a presentation, now we can do 4 or 5 a day through Zoom. So this has made it so easy. But also in all of the work that we do on the ground with our canvassers and our organizers, they have to have their little they've all been provided with their notebooks and their pads, where they have to enter all of the data of the work that we're doing. And then we have a full-time person that to make sure that the data is entered correctly, and so we have a whole data management system because we want to keep track of the work that we're doing. We get funding for this work. We want to make sure that the data is recorded and that it's accurate. So we have almost everybody in the organization is trained on doing technology. I guess the only ones that aren't, and even those that, like the members, the people that we organize on the ground, and they're a very important element. I'll just give you an example. We were trying to get Governor Gavin Newsom last year, and we were partnering with these other organizations that were working to get the healthcare for undocumented people 50 and above. We have to depend on our members, and within a week they were able to get like 4,000 postcards that we took to Sacramento and delivered to the governor to get him to support us on the Healthcare for All, Dr. Joaquin Arambula's bill to cover people 50 and above. And we have provided tablets to many of our vecinos. We call them that's the name of our membership organization is Vecinos Unidos, Neighbors United, because these are the people that did the work on the census. They did the work on the redistricting. And by the way, I forgot to add this. So right now we've got I think something like 10 days left to get people out there to sign up for Covered California. The Latinos, again, we're way behind. People are not signing up for this Covered California insurance that we have in California. So the next 10 days, our organizers and our volunteers, because we have to depend on them, they're going to be doing a crash campaign here in all of our areas where we work to get people to sign up for Covered California. Before, when we had more time before the pandemic, we actually would go door to door, and then we would get a location like a local school where people could come and sign up for Covered California. Well, now we're going to have to be doing it again digitally and getting people to sign up.
There's a question in the audience. What about partnerships with libraries who often have digital literacy courses in multiple languages, or adult basic education courses which incorporate skills that increase digital literacy? Has the Dolores Huerta Foundation had any collaborations with libraries?
Well, the sad part is, at least here in Kern County, I can't speak for Tulare and Fresno in the Antelope Valley, but here in Kern County, our libraries are not open all the time, okay? Unfortunately, Kern County, they're very good at producing jocks like Derek Carr, the quarterback of the Raiders, but not very good in the academic world. So that has been an issue. But I think that's a good idea and something that we could pursue. Actually, when we do our COVID clinics, we said, we're working together with the local hospitals and the local healthcare providers to set up our and then we take our clinics to the places where people are, to the Mercado Latino, where people gather. We take the clinics to where the people are at. In terms of the training for the digital world, I think that's a really good idea, and I think we definitely will pursue that. And as I mentioned before, I'm going to definitely connect our folks here with Daniel Turner so that we can make that happen.
Thank you, Dolores. And I just wanted to ask you if you any last thoughts you wanted to share with everyone.
Well, just one last thing. I did ask our health coordinator to be part of your symposium. And I know that we can follow up with this conversation that we just had. But I just want to say to everybody, I want to thank you all for working on health issues. When we have our house meetings, we always ask the people in the house meetings, and the people that we organize are people, low-income people. Most of them are immigrants, either recent immigrants or who have been here, not a short time. And we always ask them, what is the number one issue for your family? They always say healthcare. Healthcare is number one, education is number two, immigration is number three, but healthcare is always number one. So I just want to thank everyone that has been part of the symposium for dedicating your life and your work also to make sure that our Latino community that they're healthy and that they're safe. Thank you. Muchas gracias a todos.
Thank you, Dolores. Thank you, Dolores, for sharing your expertise with us once again. That's all the time we have for everyone today. Please transition over to the lounge and take a look at the schedule and see what's up next. Always feel free to take a seat at the lounge and mingle with others. Nos vemos. Gracias.